Whenever I'm teaching this topic in class, I like to use this example because it gives a really clear indication of what sensation is and what perception is. So here goes nothing. I voted for Donald Trump in the last election. Okay, that may or may not be true, but what I want you to know is that when you heard those words, you likely processed it differently than another person listening to those same words, right? Did both of you hear the same words come out of my mouth? Absolutely. That is what a sensation is. A sensation is just a stimulus, which was my voice, acting on a receptor. So, stimulus acting on a receptor. So for all of you, there were sound waves, stimulus, vibrating the hair cells in your inner ear with receptors, and therefore that is the sensation. However, your perception may have differed, right? One of you may have been like, yeah, we love this guy. And then the other, you maybe I actually stopped this video because you're like, I don't respect this guy anymore, right? So we have different perceptions of the same stimulus. That is called perception, which is actually processing the stimulus, okay? Processing what that is. And that is very highly dependent on how your brain has already been kind of molded in a way, right? So this is much more complex. This is very simple. So how do we understand the two separately? Well, I've got two wonderful examples of this. Number one will be a heart attack, and the second one will be something you've heard of before called the runner's high, right? When you're running and you feel really euphoric and good. So what's going on in each of these and how does sensation and perception play a role? Let's get started. So first, with the heart attack, obviously, we are going to have the heart get damaged in some way, shape, or form. That is usually due to a lack of blood supply to the regions of the heart dealing with contracting the muscles. So we're just going to say there's some sort of damage in the heart tissue. Okay, now with damage in the heart tissue, obviously we need to know about this. So your body does have some sensory neurons, dendrites, attached to this region, okay? So you're gonna point at these guys, say dendrites of the sensory neurons, dendrites of sensory neurons. Now we're going to say these guys specifically detect pain because with interoreception, basically detecting your internal organs, you can only feel pain and pressure, interestingly enough. So you're going to feel pain from your heart. What's going to happen here? Well, that sensory neuron is going to send its action potential through spinal nerves all the way to the spinal cord to a neuron located on the opposite side of the spinal cord. So generally, your heart is on the left side, so this is left, and it's going to basically cross over and talk to a neuron on the right side. Kind of interesting, hey? So this neuron, once stimulated, will send its action potential upwards to the thalamus to get sorted out and then eventually get processed up in the cortex of the parietal lobe, okay? So what I want you to know here is, well, hey, where was the actual stimulus? Where was that actually happening? Well, this is the stimulus, right? The dendrites detecting damage here. What we call this is the sensation. The sensation, stimulus, damage on receptor dendrites, right? Where do you think the perception happened? Well, the perception obviously happened once we processed it in that cerebral cortex. So this is where we have perception, okay? Wonderful. Well, not wonderful for this person, they're having a heart attack. But what's interesting about having a heart attack is you don't necessarily feel your heart itself getting damaged. Sometimes people don't feel chest pain, they actually feel pain down their arm. Pain down their arm. Why are they feeling pain down their arm if it's their heart that's getting damaged? Well, this is called referred pain, and let me show you how this works. In your arm, specifically the left inner arm medial side, right, we also have sensory neurons, dendrites down here, right? So we've got little sensory neurons because if you touch your bicep right here, right, you can feel it. And if you pinch it, you can feel pain as well. So what's going to happen is this neuron comes into the spinal cord, and guess who he talks to? The same exact interneuron that sent the signal up to the brain about what? A heart attack, right? So what's really interesting is when this guy sends his action potential and stimulates this guy to send his action potential, it is no different than if this guy, if you had pain in your arm, say like you got hit on the arm or something, it sends its action potential, guess what? It does the same exact thing. What does that mean your perception will be? virtually the same, right? So if you're having a heart attack, you feel pain in your arm because they synapse with the same interneuron, thus having the same perception. It's kind of weird. So let me tell you this. Can sensations be different but have the same perception? Absolutely, right? So different sensations can cause the same perception. Really fascinating, right? So let's take another example to see how sensation and perception may differ in a different scenario. That's going to be the runner's high. Now, in a runner's high, I'm going to have a premise here that you have some sort of damaged muscle tissue, right? So you have worked out in the past and your muscles are a little sore, right? So we're just going to write sore muscles. Okay, how do those feel? Well, obviously, sore muscles don't feel the best. So why do they feel that way? Well, we've got, again, sensory neurons that will detect those damaged muscle cells, and it will, again, send signals into the spinal cord, cross on over, and that interneuron, once again, sends signal up to the thalamus. Thalamus sorts it out, processed in the parietal lobe once again. So still, the perception's always in that cerebral cortex. Okay. However, let's say, for example, you have those sore muscles, but you decide to go on a run anyway, right? So you go on that run, and you're running maybe lightly for about 10, 15 minutes, and all of a sudden you notice something. You notice that that pain you felt, say, in your calf is gone, right? You don't feel that pain anymore, right? So you're kind of running, you're like, ooh, this is kind of nice. Did I heal my calf muscle? Of course you didn't heal your calf muscle. So what's going on here? If your calf muscle is still damaged, why are we not getting that signal back up to the brain? Well, let's check this out. So first off, let's just precede this with saying, hey, whenever this guy sends its action potential about that pain, because this is some sort of painful stimulus, we're going to stimulate this guy, send his action potential, and therefore detect pain here. So this is our perception of pain. Perception of pain. Very good. As you begin running, however, there is something called a descending pain pathway. Descending pain pathway. DPP. What is that? Well, it's a group of neurons that get activated anytime you're doing some sort of strenuous activity like running, or also whenever you're doing something like meditation or deep breathing exercises. It can also be stimulated in that case. So what's happening here? Well, we will have neurons up here in the cortex that will synapse with neurons in the thalamus again, move down to two different regions in the midbrain and then the medulla. And then that medulla neuron will come down and also communicate with this red neuron. Okay, so once again, what do we have? Neuron up here. This guy is up in the thalamus. This guy is in the midbrain. And this guy is in the medulla. Okay? And these neurons are obviously descending and they're going to impact pain. Well, how are they going to do that? Well, check out who he talks to. He talks to this red neuron that's sending the signal about pain, 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 right? So this is what's going to happen. If I were to zoom in right here, and I see that axon coming to this neuron right here, and it's going to keep going up, and I've also got this guy coming in here. Well, guess what? What's happening here? Well, normally with the pain, we're going to be sending stimulatory neurotransmitters, thus getting this guy excited to send its action potential. But when the descending pain pathway is operating, we're going to send inhibitory neurotransmitters. I'm going to point at those, say inhibitory neurotransmitters. Now, we have learned that inhibitory neurotransmitters generally make this cell more negative. And if this cell becomes more negative, what's he going to do? Or I guess what's he not going to do? Well, he's not going to send this action potential because he's negative. If that doesn't get sent, what happens up here? He doesn't send his. And what do we not perceive? Pain, right? Now here's the thing. Did the sensation change? Did the stimulus on receptor change? No. In this case, the stimulus is still here. Your muscles are still sore. Stimulus still here. But what's changing? What's changing? The perception. So although your muscles are still damaged, you are not feeling it, because of this descending pain pathway modulating that red neuron here. So you see how we can kind of interplay with a heart attack and referred pain as well as this descending pain pathway to modulate perception. Very cool. Hope you learned something.